So when you're handed the diagnosis of heart disease, it comes with a flurry of emotions. And I say this because it's not just you, it's also your family that are going through emotions of anxiety and anger. How could this possibly happen to me? Sadness that, wait, I'm not perfect. I'm not, that young 18-year-old healthy. Shocked of how did this happen? Stress, how am I going to pay my bills? And I may be worried about some of that. But for some of you, you actually may be relieved. There are some conditions where you just don't feel well and you can't quite put your finger on what it is. But to know that not feeling well is due to a certain condition is actually reassuring for some of you. So I want to encourage you and to reassure you that all of these emotions are normal, and you will go through them, or you may go through them at some point. So this is what our cardiac rehab room looks like when you come to Cambridge Cardiac Care. We've actually undergone a renovation during the pandemic it's sad, but no one can actually see any of it. So we are encouraging you to realize that cardiac rehab is not just the physical, the exercise program. It's not just crunch fitness. It is both physical, dietary, emotional, sexual, and work social reintegration. The education component of cardiac rehab is as important as the exercise component, because if you realize why you're doing what you're doing, then you feel better about it, and you are more likely to continue. One of the benefits, believe it or not, of this pandemic is that anything you do independently and you can do in your own home, you are more likely to continue doing this, and this is actually a benefit. So what are the goals of cardiac rehab? Some of you are in cardiac rehab because your specialist, your cardiologist, your family doctor has told you you need to be here. But I encourage you to set your own personalized goals. Something to the effect of, to better understand my disease. You don't have to understand all of cardiology. You just need to understand your disease states. What strategies can you find to help you with exercise, healthy eating, and quitting smoking? And some of you may be already doing some of these things, but there are increased strategies that you can use. And the last part may be to modify your risk factors, but you first need to understand what are your risk factors. This is your day-to-day cardiac rehab team. And you'll notice that Dr. Candy is the cardiologist, but if he's not in the building, when we eventually start exercising in the building, it will be maybe an emerge physician or another physician. We have, you will notice that there are 4 nurses on our slide at the bottom left. I'm sorry, but someone borrowed my mouse today, so I'm working with just the keypad. But we actually have 7 nurses in the building. So we have a good team that's there for you. We have Katie and Carly, who are part of your the cardiovascular technologist team that's going to figure out where your starting point is, because each of you will have different starting points. We've had people as young as 25 and people as old as 90, and as you can imagine, they have different fitness levels and they have different starting points. So we have to find out where your starting point is and then move you forward from there. On a weekly basis, you'll be chatting with both Nick or Jonathan, and they're part of your cardiac rehab team, but now you know what they look like. There's Emily and 4 other admin team members that you will be dealing with. So when you do call in, always give your name and your date of birth, so we don't want to make a mistake with someone with a similar name to you. So always verify who you are. And I encourage you to find out about your next appointments. If you give us your email address, we will email you your following appointments, and that may help you get a little bit more organized because there are several appointments. So as I said, my name is Michelle. I wear many hats within Cambridge Cardiac Care. I happen to be the pharmacist who will be doing your medication lecture on the Wednesday of Education Week. With that lecture, I ask you to please put out your medications And certainly it's a 2-hour lecture. You will come out with more questions than you go in with. I'm also the clinic manager and the rehab manager. So having said this, I am, and Holly is, your complaints department. So this is your day-to-day cardiac rehab team that you're going to interact with. At this point, we would have had a graduate speak to you about what you may go through with cardiac rehab. And because we're in the pandemic, Patrick is not going to be speaking to you, but he's got a couple of points that he touches upon. One is ask questions. If you ask questions, you're more likely to get more out of it. Your questions are not stupid. They are valid questions. You have concerns about them, so certainly ask them. As well, he would say have fun. If you're not having fun while you're exercising, and for some of you, you're not having fun, you're not going to continue doing this. You will do this only for the time you're in cardiac rehab. So figure an exercise strategy where you're involving a family member or a friend, and perhaps you're going for a walk outside with them, but have fun when you're doing it. And I will tell you, when participants started in cardiac rehab, the first few lectures, when they came into the clinic, they weren't smiling. But after about 3 weeks or 4 weeks of exercising regularly, there was a big smile on their face. And I didn't know whether that was because they were thrilled that they were done with the 1 hour of exercise and they were free for the rest of the day, or they started to feel better. But one of the things you do find with exercise is that it does improve your mood. So we're going to start off with a few definitions, and we're going to define what the heart is. And I've got a little model here, but the heart is, and I'm going to hold it up to the camera, but the heart is like a two-sided pump. And essentially what it's doing is it's pumping blood to itself and the rest of the body, about 4 to 5 liters during rest. And then when it pumps the blood, it's supplying nutrients and oxygen-rich blood to itself and other parts of the body. The coronary arteries are the arteries that supply blood to the heart itself, and it keeps the heart nourished. The blood flows inside the artery, and a normal artery is quite clean. And you'll notice it right here, it's quite clean. And over time, plaque can build up inside that artery. And when it does, it's called atherosclerosis, and it results in the narrowing of the artery due to that buildup of fatty plaque within the walls. When this happens inside the arteries of the heart, the coronary arteries, it's called coronary artery disease. So your first question, and I know you're all muted, but I want you to answer it, and it doesn't matter if you get it wrong or right. But true or false, does plaque build up and atherosclerosis begins with old age? True or false? Actually, fat builds up and atherosclerosis begins at the age of 2. So from the first decade of life, you start to see buildup, and typically for males, it's in that 4th decade. So I'm going to be holding a little model up here, and you'll notice this is you at birth, and over time, there's an accumulation of cholesterol. The next one is atherosclerosis affects only the heart. Well, it's actually false. It affects also the brain, the legs, the lungs, and other parts of the body can also be affected. So if there's narrowing of your arteries and going to your neck, the carotid arteries, it can result in ischemic stroke. If there's narrowing of the arteries in your legs, that can result in peripheral vascular disease. And if there's narrowing of the arteries in your heart, it can result in angina, a heart attack or myocardial infarction or an MI, or sudden cardiac death. Now I want you to try and list the signs and symptoms of angina or heart attack. And for some of you, you may not know what this is. So there are typically 6 signs and symptoms, and you don't have to have all of them. So it can be chest discomfort, sweating, discomfort in other parts of the body. So that would be from your neck to your chest. I mean, not neck, but from your nose to your chest. Nausea, shortness of breath, and lightheadedness. And I want to let you know that you actually don't have to have all of them. You could have some of them, such as just shortness of breath. And one of the reasons I'm so passionate about cardiac rehab is that I happen to be the family member of someone who had her first cardiac event at the age of 53. And she happened to be diabetic. So I use the word female and diabetic. And the reason I tell you about that is because diabetics and females, either of them can have atypical symptoms. So the family member I had, her angina equivalent was actually ear pain. And you think, well, that's why I use the discomfort from the nose to the chest. Anything in that area can be your angina equivalent. And the idea is, do you know what yours is? So what is a heart attack? Well, when fat builds up in the arteries of the walls, plaque can break off, causing a blood clot, and blood flow of the clot, when it flows downstream, can cause a heart attack. If the blockage continues, the muscle can get damaged or it can die. So I use the example here of clean arteries, and then this is somewhere, and I'll use another model, okay? And I don't know if you can see this in the camera, but it's between here and here that you actually start to have the symptoms of angina, or you may have your heart attack. And that's why when we talk about cholesterol medications, we realize that you don't have much artery left. Now keep in mind that your arteries are one giant set of plumbing. So whether blockages occur in your neck or your legs or your arteries, it's still one continuous pathway. There are two main types of heart attacks. One is called a STEMI, which is an ST elevated MI, and that means it's a large vessel fully blocked and it is more dangerous. Or you can have an NSTEMI, which is a small vessel fully blocked, or a large vessel partially blocked. Now I encourage you, if you've had a cardiac event, to get your report card. This is something you always want to keep with you. And if you travel, you can pull it out, because if you've got a stent, obviously you want to tell them, because you may set off the metal detector at the airport, or if you've had multiple stents, or if you have to carry your medications with you, certainly you want to show that you are a cardiac patient and you need to keep your medication with you in your carry-on luggage as you travel, though none of us are traveling right now. Getting to the hospital can be a problem if you delay it. So most people, for some people, they may have a cardiac event at 4 and 5 in the morning when you have a cortisol surge. And you're thinking, well, I'm not going to wake up my spouse, maybe it'll go away. But you want to wait no more than a few minutes, no more than 30 minutes, no more than using your nitro spray 3 times. Please do not go to your cardiologist's office or your family doctor's office, because we don't have the medications to open up those arteries. You have to call 911 and go by ambulance. When you do call 911, please unlock your front door, because if you don't answer your door and your door is locked and you call for 911, they may break down your door, in which case you'll have 2 problems now. Yes, there is a cost. It's $45. However, we had a patient in cardiac rehab. Sir, I'm just going to ask you to please turn off your video. Okay. Hold on one second. Thank you. We encourage you. We had a patient in cardiac rehab that essentially had to call a 911 while he was in the US. It was a 17-mile drive, and he paid almost $2,000 US for that ambulance drive. So keep in mind, $45 is going to save you on parking. They're going to start emergency treatment en route. They're speaking to the emergency doctors. They've created pathways within the emerge that you're not going to be necessarily exposed to COVID, but you do not want to be going with a family member, because if something happens en route, either of you or both of you may panic and it may result in an accident. So time is muscle. We do encourage you, if you think you're having a cardiac event, even if it's a false alarm, please do call 911. It is better to be a false alarm than to have damage to your heart. How big is the problem of heart disease? It is the #1 killer worldwide of people. More than 12 million deaths annually, more in the last 30 years in developing countries such as India and China. And that's because of the increase in fast foods and the change in diet and the more sedentary behavior. So why me? That is your question. Why did it happen to me and not somebody else? And I would say to you, it is because you are more genetically predisposed. Your parents, your genes, predispose you to heart disease. So if you think about it, in your family, typically there is a family member that has had a similar cardiac event that you have. So you are at increased risk because of your genetics. Poor management of fats, metabolic syndrome, or this weight gain in the belly, and we're going to get into that more. Urbanization, and you see in the second picture below on the right, a sprawling city. And if you live in the suburbs, maybe the Kitchener, Waterloo, Cambridge area, you would realize you drive to go to the grocery store and you no longer walk. That sudden change in lifestyle has resulted in increased sedentarism, which may result in an 8-hour workday where you're sitting at a computer, or perhaps you're driving a vehicle, maybe a truck or something else, where you're sedentary for part of the day. The idea is we're meant to be up and moving, and we're meant to not be sitting at a computer. So one of the things that I had seen at a conference was a big X across a couch in the evening. Why? We tend to watch TV and we sit down for most of the evening. And the idea is you can still watch TV and be up and about. Perhaps you're up during the commercials because you don't really need to watch those commercials that tell you to go buy things. You don't need to buy anything. So there's certainly ideas. You could do the stairs maybe. There's certainly several ideas of how to decrease that sedentary behavior and maybe within the hour get up and move. So your questions to me are, well, what are my risk factors? There are certain risk factors you can do nothing about, and those are age. Over time, as you age, and I'm bringing back your model here that says you accumulate more cholesterol with time. Typically, it is male over the age of 45 and female post-menopausal or perimenopausal. So menopause typically happens around the age of 55, but sometimes it can occur a little earlier for women. That's when a woman catches up to the man, and it basically results in a similar risk. Male, an automatic risk factor. Certain cultures within 5 generations are at higher risk because they have smaller arteries, such as First Nations, African, South Asian descent, and Arabic. And a family history. This is not an equal risk factor. Family history is actually a doubling of risk. So if you have a parent, a sibling, or a child, and remember the child gets the genetics from the parent, if you have any of those, keep in mind that you may be at increased risk. Now, these are the risk factors you can do something about. High cholesterol, smoking, high blood pressure, diabetes, obesity, alcohol, physical inactivity, and stress. The most important thing I'm going to tell you in this lecture, I will repeat again, but I'm going to say it now. 90% of your risk of heart disease is modifiable and controllable by you. 90%, because you can control your high cholesterol, the smoking, high blood pressure, diabetes, obesity, alcohol, physical inactivity, and stress. And when we talk about stress, there's the concept of stress and distress. Stress can actually be a motivator for you to actually get something done. However, if you remember a few years ago, there was a fire in California and the entire city burnt down. So recognizing that everybody is in the same mess, one or two individuals may have said, okay, well, I've got to find a place to stay tonight. I've got to call my insurance company, and then I've got to make a list. I've got to do this and this and this and this, and whatever I don't get done today, I will do tomorrow. But the idea of putting it down on a list gets it out of your mind. You stop thinking about it. You stop ruminating about it. And that idea of being distressed where you can't do anything, you're holding your head and you're just incapacitated. That is not useful. The distress is not useful, but actually being motivated to do something can be beneficial. So let's get started with cholesterol. What is cholesterol? Well, it's a vital part of the body and it does circulate in the blood. However, too much cholesterol can form plaque and block arteries, and typically there are no symptoms till you get to the angina or the heart attack. Where does cholesterol come from? It typically is made up by you. 65% of it is genetic. It is what your body produces. It comes from the genes from your parents. 35% is only what is ingested by you through diet, and that's what you can control, is the diet part of it. So the food sources that contain animal fat and meat products are where you're getting the bad saturated cholesterol, and this is what's going to build up. But remember, it's 35%. So when we talk about cholesterol, there are different values that you have to pay attention to. Now remember, you're going to get blood work done. You can get your own results. That is possible. And you could look at what's abnormal. So if you want to grab a pen and write some things down, LDL, your target LDL is going to be less than 1.8. If you get it to less than 1.4, it is less than 1.4 will decrease 2 additional heart attacks for someone who's already had established disease. So LDL as low as you can get it. And remember, there are multiple subtypes. So there are 4 subtypes of LDL and 3 of HDL. And in Canada, we get a calculated number. So if some other types of cholesterol are abnormal, it is hard for you to get this breakdown of LDL. So LDL as low as you can get it, and even unmeasurable, is good. There's a group of people that live in the blue zones, and I want you to write that down. The blue zones are where people live to well over 100. They are healthy, they have no dementia, and they have good genes. And these people happen to live in Osaka, Japan, Loma Linda, California. There's parts of Italy and part of Greece where you have genetically people who are living to well over 100. So as low as you can get your LDL, the better. And there are things that you can do, such as exercise and other things, to lower it. But the big one is actually medication that decreases it by at least 50%. So know what your LDL is. That's the number that the doctor's going to focus on first. But once your LDL is managed, we have to look at raising your HDL. And HDL is your good cholesterol. And if you're female, you want it above 1.3. If you are male, you want it above 1.1. And what really works on HDL is actually just exercise. You need to have muscle, lean body weight, and shed some of those extra pounds. Typically, it is higher in women, and it is what's carrying out your bad cholesterol. So I want you to think of it as being that shovel or that garbage truck that's carrying out your bad cholesterol. But if your HDL is like 0.8 or 0.9 and it's too low, you need to increase that. And diet is not necessarily going to get you what you want. And these days, medication doesn't get you there either. It is mainly the hard work you're going to do with exercise. So typically, anybody over the age of 20 is going to have their cholesterol tested at least once. And then if you can do a 10% reduction in your cholesterol, this is an important point. A 10% reduction in your cholesterol will decrease your risk of heart disease by 20 to 30%. So what does that mean? A 10% reduction in cholesterol. So if you are 2.5 and you drop it by 0.25, you've decreased, so just 1 decimal place over, you've decreased your risk of heart disease by 20 to 30%. The next thing we're going to focus on is smoking. And for some of you, doesn't affect you at all. But we're going to touch upon smoking, cigarette smoking, nicotine, and marijuana. And the realization that for those of you who don't smoke, why do smokers smoke? Well, in 7 seconds actually, they feel amazing. They have an antidepressant they have your aha moment, and they have something that's almost as good as caffeine that makes them alert. And nothing gives it to you that fast except cocaine. So in 7 seconds, this phenomenal delivery system that has put in 7,000 chemicals into it, 70 of which are known carcinogens, makes you feel amazing. And that's why people smoke. It's one of the hardest things to quit because for some people, the cigarette is their best friend. However, you can substitute and use clean nicotine products. We discourage switching to vaping because vaping is just another crutch. It is better for you to use either a patch or some other nicotine replacement therapy as the inhaler, the patch, the gum. Because why? It's not coming to you in 7 seconds. Instead, it's coming to you a little slower so you can wean off of it. The 70 carcinogens include formaldehyde, mercury, toluene, car battery fluid, white ant poison, all sorts of horrible things that are put into this amazing delivery system. So why do we not want you to smoke or try to decrease, or every cardiac program is going to either try to help you decrease or quit? And that's because cigarette smoking will transiently increase blood pressure. It will decrease your good cholesterol, which is scooping out your bad. It's damaging your arteries and blood cells and predisposing you to diabetes. It's increasing your risk of heart attacks. And you're ingesting 7,000 chemicals, 70 of which are known toxins. Now, some of you will say, okay, well, I don't smoke anymore. I use marijuana and it's legal. And yes, it is legal. So we encourage you to tell us if you are using marijuana products. Now, we would prefer, if you use them, to use the edibles, keeping in mind that the edibles are slower in their onset. So I don't know if you remember 2 or 3 years ago, the police officers that ingested a few brownies and then about an hour later ended up calling 911 because they were high. So the realization that edibles are better for you than the inhaled the joints. And keep in mind, if you use a joint, it actually is worse for you than a cigarette because it's got large particulate matters. There's no filter on it. And essentially you're damaging your lungs worse than if you were smoking a cigarette. So or you could use, I guess, a hookah, which is a little bit better, but not much. So ingesting it into your lungs, although it's a faster rapid onset, will result, and a faster high, will result in damage to your lungs. And the edibles are a bit better. Remember to keep them out of the reach of children. I know some people may make cookies, and we've had a colleague of ours that their family member smelled someone making cookies at 3 in the morning, woke up, had a few cookies, went back to bed and thought, oh my God, I'm having a stroke, because they didn't understand what was happening with them. They didn't realize that the marijuana butter, they were ingesting a marijuana product. So keep in mind, if you do use these, please, it is legal, but disclose it to your healthcare provider. When we talk about blood pressure, it is important, and in cardiac rehab, you're going to be measuring your blood pressure. So you will have either an automated one or a mercury sphygmomanometer. An ideal blood pressure is 120 on 80 or less. And for younger women, that is not a problem at all. For people with heart failure, your medications are certainly lowering your blood pressure. But if you're above this, it could be that perhaps you maybe had a coffee right before, or you've got to go to the bathroom and you're a little bit agitated, or you're frustrated with somebody. But the idea is, when you measure your blood pressure, void first, don't have any caffeine, maybe take your medications, sit down, wait 5 minutes, legs flat on the floor, hands at heart level, and measure your blood pressure after you've been sitting still for 5 minutes. Things you can do to modify your risk factors for blood pressure, in addition to medication, are diet. Following the DASH diet, which is considered still the #1 diet in the world, along with the Mediterranean diet. They don't contradict each other, or the diabetes diet. Losing a bit of weight, 10% reduction in weight, will make a huge difference in your blood pressure, your cholesterol, and certainly other parameters like your blood sugars. However, it's difficult to do. but we encourage you with exercising and with diet to watch how much you're eating. Exercise will lower your blood pressure to some degree, but also salt restriction. So instead of bringing out the salt shaker, bring out the lemon and put it all over. Remember, medications are still key. You cannot manage your blood pressure through strictly diet and lifestyle measurement, lifestyle things. You can still be thin, and if you're genetically predisposed to have high blood pressure because it runs in your family, you likely will develop high blood pressure as well. So it's important that every time you go to a doctor's office, they will measure your blood pressure, and it's important that you know what your normal is. Diabetics have a 2 to 3 times higher risk of a heart attack or a stroke. A diabetic is more likely to die from a heart attack or a stroke because diabetes happens to be 3 disease states in one. It is not just abnormal blood sugar, it is also abnormal blood pressure and abnormal cholesterol. So this triple combination puts you at an increased risk, and 80% of diabetics will die from heart disease. So if you are diabetic, you need to realize, I will be also doing your diabetes lecture, but the realization that you will need to make some lifestyle changes, and people, healthcare providers focus on you and once you become diabetic. Now, a lot of people know that they're diabetic, but once they've had their cardiac event, now they're ready to pay attention to diabetes. So if that's the case, let us know. We can re-refer you back to the dietitian. We can re-refer you back to the diabetes daycare, and you may be ready to make some lifestyle changes now. When we talk about weight, we talk about obesity, we use a term called BMI, or body mass index, and it's a way of your packaging. So I'm going to speak to you about a person who's 160 pounds. Now, a person who's 160 pounds could be 6 feet tall and fairly lean, or maybe a little bit robust, or they could be 5 foot tall and 160 pounds, which would be, they'd be a bit boxy. So that BMI, if you're above 30, puts you at increased risk, 2 to 6 times increased risk of heart disease, but other diseases as well. As well, we focus on the measurement of your waist. And when we talk about this, notice the gentleman below where he's wearing his pants, they're below his belly button. The measurement with your waist, and I'm going to use a tape measurement here to show you. We've got one here that says the waist measurement, and you can buy these flexible tapes anywhere, maybe the dollar store, maybe a sewing store. You can basically, you measure it at your belly button. If you have apple-shaped body, you are at increased risk of heart disease. A pear-shaped body, which is a smaller waist than hip, so a smaller waist to hip ratio, it decreases your risk of heart disease. So if you are a male and you happen to be a Caucasian male, your waist measurement has to be under 40 inches or less than 102. Now remember, it's not where you wear your belt, but it's at your belly button. So I'm going to show you this, and we have this measurement at the office. And then if you happen to be that high-risk individual where you come from maybe the South Asian descent or African descent or Native, you have to have a waist measurement that's less than 35.5 inches or 90 centimeters. If you are female and you're Caucasian, your waist has to be between less than 34.5 inches or less than 88 centimeters. And if you happen to be a high risk, remember there's a little female on here. So if you happen to be a high risk individual, your waist measurement is less than 80 or 31.5 inches. So that waist measurement, where you carry your belly fat, matters. And that's because belly fat is active fat. It's communicating with your, it's sending messages through hormones to your brain, to your liver, to your other organs, and it may be pushing against that liver and increasing your LDL. It may be pushing against your pancreas and pushing you towards diabetes. So the idea is belly fat is active fat. Now, having said this, if you're diabetic and if you're female postmenopausal, that's where you're going to gain weight. and it's the hardest place to lose weight because you lose weight on your overall and your full body. So remember, you can't do necessarily just targeted weight loss, and these are questions that you can talk to Nick and Jonathan about. When we talk about alcohol, we talk about 2-4. We talk about no more than 2 drinks a day, no more than 4 days a week if you are male. If you are female, no more than 1 drink a day, no more than 4 days a week. Now, I just watched on the CCC, they talked about if you are drinking more than 3 days a week, you are at increased risk of developing breast cancer, and your risk of developing cancer increases if you're female, just drinking by 15%. And if you're drinking every day, you have increased risk by over 50%. And society dictates that if you need to relax, you should have a glass of alcohol. And the idea is you can substitute that out for a walk. But keeping in mind, certain people have to cut back their alcohol, certainly if they are on blood thinners or if they're on dual antiplatelets when you have a stent. And we're going to get into that and in another lecture. But the idea is even small decreases in drinks can be beneficial because of the large amounts of calories in alcohol. So you cannot drink 4 drinks a day. You'll end up with the gastroenterologist. I love this slide because it talks to you about physical inactivity and the fact that we're all at the point where we're in baby steps. So when you have a child that starts walking or you have someone that's new at it, you're saying, well, you want me to start walking? Well, how fast should I walk? And how many times a week do you want me to walk? And how far should I be walking? And what's my optimum aerobic heart rate? And do I have the right shoes? These are all the right questions to be asking. And this is what your exercise prescription is telling you. So we encourage you not to do the bare minimum of 150 minutes a week. That's the bare minimum of moderate intensity exercise. I encourage you over time. And some of you have just come out of the hospital and you're not physically fit yet to do everything. So you can do them in as little as 10-minute intervals to have exercise and do it that way, to exercise for 1 hour. So I would encourage you to aim for 1 hour of exercise 7 days a week. And then if you do less, it's okay. But if you aim to do only 3 days of exercise and something happens and you lose that day, well then you haven't achieved what you needed to do. Now, when you looked at our gym, you realized you needed nothing complicated. All you need is a pair of running shoes and you need to have a water bottle. That's it, unless you are fluid restricted. So, having said this, we don't want you to go out and buy anything. Post-pandemic, or at least during the pandemic, the weather's beautiful outside. Perhaps you can walk outside. You can perhaps hit the stairs in your home if that's not a barrier and your knees are good. One of the things that we had a 90-year-old that would exercise in her apartment building pre-COVID, and she would walk across the stairs, down a flight of stairs, across the floor, down a flight of stairs, across the floor, down a flight of stairs, take the elevator back up to the 19th floor and start all over again. But again, remember, exercising up and down stairs is a bit more on your heart and is a bit more physically active than just walking on a straight line. Another option is to get your bike out and perhaps make it a stationary bike, or if it's post-pandemic, go exercising in the mall. There's a great mall walking program at Cambridge Mall where they start at 6 in the morning. Parking's beautiful at that time. There's benches, there's water bottles, there's water fountains, and there's washrooms. Mall walking is beautiful, and a friend of mine lost 77 pounds walking 11 miles, mind you, that's a bit extreme, at Cambridge Mall every day. So that is a possibility that you can find, and you can discover what works for you at home. Exercise and depression. We discuss how you feel a lot in cardiac rehab, because depression, what happens during a cardiac event is you release a set of hormones, perhaps when you're having a heart attack, or when you've undergone a bypass surgery or something like that. And that flurry of hormones is the same hormones that you release if you are depressed. Now, if you are depressed, you are less likely to exercise. So having said this, exercise decreases depression, but depression is a barrier to exercise. So we will ask you, How are you feeling? At least once, maybe every month, hopefully. And discuss that. Feel free to be honest. And there's nothing wrong if you need to go on medication temporarily. If that can get you motivated enough and it can improve your mood to get you out of bed, then that we've taken away that barrier to physical activity. Keep in mind that when you exercise and if you run or if you can jog, there's a release of endorphins that give you that happy hormone. And oftentimes you'll find that people who are exercising regularly have a more positive outlook. So remember, if you need to have that buddy to exercise with you that perhaps lives in the house with you, get that buddy in mind, and you can get them to motivate you when you're not in the mood, and you can motivate them. So risk is a continuum. It multiplies, but you don't have to have large elevations in your risk factors for them to be additive. Remember, they multiply. And when you think of numbers, think of your cholesterol, your total cholesterol being less than 4, your LDL being less than 1.8, but Canadian doctors will remember less than 2. HDL being above 1.3 if you're female, above 1.1 if you're male. And triglycerides tend to be elevated in some people genetically, or if they're diabetic, or if they're drinking alcohol. So at this time, we're going to have our sex talk, and this is a very important part of people's lives. So if you have a regular partner, it's a difficult conversation necessarily to have. And people who are in cardiac rehab will do better returning and reporting greater sexual satisfaction and returning back to sexual activity with their regular partner. Speak to your doctor if you need to consider medications or options that work for you. But when can you return back to your normal relations with your partner? When you're able to climb 2 flights of stairs and walk briskly without any shortness of breath, you may be safe to return. Some tips to slow down to reduce the work on your heart. Avoid positions where you're holding your weight up. Use the spoon or snuggling position behind your partner and the healthier partner on top to reduce the work on your heart. So I find this part of the talk to be very useful because as a cardiac rehab participant, you need concrete numbers. And what we talk about and what cardiologists, they're very concrete. They say, tell me about number needed to treat to save a life or to prevent an event, to decrease a hospitalization. So those are the numbers I'm going to share with you now. There's a decrease in mortality of 1 in 4. So we have 11 people on the call right now. If we had 12, 3 people would not die if you were to start and finish the cardiac rehab program. Out of the 11 of us, 2 would not, because 1 in 5 will not go to hospital because you are in a cardiac rehab program and you're exercising and you're following that cardiac rehab program and you will finish it. Your recovery time is going to be decreased by 50%. So if it normally would take you 4 months to start to feel better, it's going to take you 2. We're going after 4 behaviors. We're not just looking at physical activity. But if you look at physical activity, it improves multiple disease states, including cardiovascular, cancer, diabetes, osteoporosis, and mental health. But we're going after tobacco, diet, and alcohol. So in cardiac rehab, that is why it's so important for you to attend these lectures. This other way of looking at it is basically saying, if you change your diet, you decrease your chances of having a heart attack by 39%. If you decrease your alcohol, you decrease your risk of stroke by 26%. If you increase your physical activity, you decrease all-cause death by 37%. And if you quit smoking, you decrease your risk of cancer by 53%. You'll notice that physical activity, the increase in that decreases your risk of cancer. So all but 2 cancers are not affected by physical activity. So there are multiple ways that all-cause death is decreased by cardiac rehab. So then your question to me is, well, why is everyone not in cardiac rehab? Well, one is Making lifestyle changes is very difficult. People don't want to make changes. They want to go, their goal is to go right back to doing what they were doing before. And the point of it is to realize and to be open to the idea that if I go back to what I was doing before, I'm in the same mess again. So what I need to do is I need to make some lifestyle changes and be open to that. Now, we're not going to change everything about you because you are obviously great as you are and you're special as you are, but we do want you to increase certain behaviors or decrease certain behaviors and be open to what you're able to do in that. So cardiac rehab is in addition to your medications. What can we expect if you finish and do the full cardiac rehab program, including the extension part of it? You will decrease your risk of you decrease total cholesterol by 24%. Your LDL is going to decrease by 37%. Your plaques in your arteries are reduced. You are increasing blood flow in your arteries, and your angina is decreased by 91%, and chest pain. So some people will come to cardiac rehab just prior to going to surgery to make them and to get them more physically fit. So what you take away from this is 90% of your risk is avoidable, modifiable, and controllable by you. But a healthy lifestyle is not deprivation. But if I right now offered you either an apple pie or an apple, I know what all of you would take. You would say, give me the apple pie, Michelle. But eventually you'll say, Michelle, give me the apple with some cinnamon, and I'm going to cut the apple and eat it that way. I don't need the 1 hour more of exercise. That apple pie is going to take too much out of me. I got to do another hour to eat if I eat it. So I don't want to do it. Just give me the apple instead. You will find heart healthy ways to bring heart healthy habits into your life. Now, Dr. Pandy does put out cardiac information on his Twitter feed. It isn't anything political. If you wish to follow him on Twitter, that is his Twitter handle. At this point, I'm going to ask for permission to involve every cardiac rehab participant in a Canada-wide registry. Now, this registry allows us to see how we're doing compared to the rest of Canada, our cardiac rehab program. Having said this, your name never leaves. We would be breaching HIPAA. There's no identification that tells you who you are, and there's no way it can be traced back to you. But we need to be able to see how our program is comparing across to another program. For example, is our smoking cessation program as good as the one at the Ottawa Heart or the UHN Toronto Rehab Center? We compare ourselves. So that's why if you allow us to participate, so this is an implied consent. You have to tell us if you don't wish